knock, knock. Hi guys. I'm Harvard Dermatologist, Dr. Abby Waldman, and this video is for you if you have been noticing more hairs in the sink, in the shower, on your hairbrush, or maybe you're even noticing a few bald spots. Hair loss is a really common problem, and there are lots of different types of hair loss, but today we're going to be talking about the type that is caused by a stress or an event called telogen effluvium. I'm going to talk about the types of stressors that can cause telogen effluvium, things that you can do to make it heal faster, to get your hair growing faster, how to know if your hair is growing back, and signs when you should seek medical advice for your hair loss. So first, what is telogen effluvium? So normally about 85 to 90% of your hairs are in the anagen phase. That's the growing phase. It's about 2 to 5 years that it takes to stay in the anagen phase, and it grows about this long. And it's kind of genetic how long your anagen phase is going to occur. The additional 10 to 15% of your hairs are in a telogen phase. A telogen phase is the resting phase. It lasts about 4 months, and then that hair is going to get pushed out by a new hair coming out in the anagen phase. And this accounts for the normal hair shedding that you have every day. So it is absolutely normal when you're brushing your hair or when you're sleeping or in the shower to see a few hairs come out. And it's actually 100 a day. So this is what, a little bit of a normal hair in the drain would look like. And this is what sort of an abnormal amount of hair in the drain would look like. So telogen effluvium is, as the name suggests, when more of the hairs get switched into that telogen phase. So instead of 10% of the hairs, it can be 20% of the hairs or even 30% of the hairs. And it basically happens when there's a stress on your body. That can be a physical stress, like you just had surgery, you just pushed out a baby, you just started a strong medication, or you changed the dose on your medication. But it can also be a psychological stress. It can be just that you've been under a huge amount of stress, taking care of a family member, being stressed at work. All of those are signs to your body that, hair growth is not important. They're gonna focus on those other things that are going on to maintain your body, and they're gonna kind of stop putting energy into growing your hair. And because of these delays that I described in each phase of the hair cycle, sometimes that hair loss is not immediately after the stress. In fact, more often than not, it's actually 3 to 4 months after, because again, that telogen phase lasts for 4 months. And so you might have had a baby back in October, but you all of a sudden notice your hair falling out in January or February. And sometimes it can really take a lot of thinking to identify what that stress was, since so many different types of physiologic and psychologic stress can cause telogen effluvium. So things aside from what I already mentioned about the surgery and the medications, you might consider, calorie restriction, severe dieting, where you malnourished, not having enough protein, zinc, iron, sometimes vitamin D, thyroid disease, or inflammatory bowel disease can be related to having telogen effluvium. And of course, in this day and age of COVID, infections is a big one, with more than 73% of patients experiencing hair loss, telogen effluvium, after a COVID infection. And even many, I think about 30%, experiencing pain in their scalp after COVID infections. So the good news is that telogen effluvium is temporary. 95% of the cases, they resolve on their own without any sort of intervention. Of course, that means having taken away the stress that initially caused the telogen effluvium. The bad news is that it can take a while. Usually, even after removing the stressor, there's a 3-month lag. So you're not gonna even notice any growth for 3 months, and even up to 6 months to get back to a normal hair cycle. And then once that hair starts growing, of course, it takes a very long time for it to kind of reach the length that the other hair is gonna grow. So you're gonna, for a while, have these kind of small spiky hairs that are sticking out and kind of causing your hair to look quite silly. That's a good sign that your hair is growing back. Now, while 95% of these cases resolve on their own, of course, that leaves 5% that don't. And sometimes telogen effluvium can be difficult to discern between other types of hair loss, such as alopecia areata, frontal fibrosing alopecia, androgenic alopecia, such as male or female pattern baldness. And so if you're not noticing significant hair regrowth by 9 months, it's advisable to seek advice from a doctor or even a dermatologist, particularly a hair specialist, so that you get the appropriate diagnosis and treatment. And one other thing is that when you have telogen effluvium, you may also notice indent in your nail at the same time, because just like your body doesn't want to spend energy making hair, it doesn't want to spend energy making nail either. And so you'll notice like a little dent, and usually that dent will kind of grow out over 6 months to a year. Okay, so what can you do to help? What can you do to speed up this process? Yeah, I know it's gonna get better on its own. You just have to be patient. So the first thing is that you do need to remove yourself from the stressor, right? So if it was like an acute event, like giving birth or having a surgery, that's just gonna be a one and done type of thing. But what if this is like a long-term stress, right? This is like your job is causing really significant psychological stress, or you're in some sort of situation. You know, really the best thing to do is to identify and remove yourself from those types of situations, using ways to decrease your stress like exercise, yoga, meditation. All of those things may reduce the stress and help reduce that hair loss. You want to focus on having a balanced diet. So make sure you're getting enough protein, recommended protein dose. Make sure that you're getting enough zinc, iron, and vitamin D. So really make sure your plate should be tasting the rainbow. You should see all sorts of colors on that plate, as well as a healthy serving of protein with each meal. I get asked a lot about, you know, which supplements should you be taking for hair loss, and there's no proven supplement. Like, so yes, you want to make sure you're getting enough zinc, getting enough iron, but generally getting more than you need for those things is not necessarily going to help hair. You just want to make sure you're getting the recommended value. That being said, there was a review published in the last year or two that showed that hair and nail supplements probably do help. So picking a hair and nail supplement such as Viviscal or Nutrafol may help. You know, there is a cost and benefit in that they can be quite expensive, but they may provide some benefit. Again, this was just based on sort of a review, a general review of what's out there in the literature. And obviously you don't want to start any supplements when you're breastfeeding or pregnant without checking with your doctor. So what about minoxidil? This is Rogaine. That, it will certainly help. It can make hair grow back a little bit faster, kind of kick it back into that anagen phase if the stress has been removed. The downside with minoxidil is it is kind of a continuous thing, right? If the hair is not ready to be back in the anagen phase, you might lose that hair that you got from the minoxidil, but you probably won't get additional hair loss. It'll just be sort of whatever you had regrown faster. So it is something that you want to commit to, I would say, for like at least 9 months to a year if you're going to do it. You can use oral minoxidil. Prescription from a physician will help as well, although the topical is probably more effective. And both are obviously contraindicated if you are pregnant or breastfeeding. Hair oils like rosemary oil or castor oil have been shown to have some effect as well. Certainly low risk, and certainly other treatments shown to help hair loss like LED light, microneedling, PRP, all of those will help. But again, this is a phenomenon that's gonna get better on its own anyway. And so if you can be patient, you might avoid spending lots of money on hair products and procedures for something that's gonna get better on its own. And so just keep that in mind before you run out the door and buy a bunch of stuff. So if your hair loss is not returning around that 6 month, maybe 9 month benchmark, then you wanna check in with your doctor. And the reason is that certainly telogen effluvium can be confused with other types of hair loss that don't go away on their own. And some of these require a physician to test, sometimes a biopsy, sometimes a hair pull test, or just a clinical examination to identify those and then direct you to the right treatment for that particular type of hair loss. If there's a particular other type of hair loss that you're interested in knowing about, please leave it in the comments and I can do a video on that in particular with those, because each hair loss is very different in terms of its treatments. So hopefully we will all have less stress in our lives and we can stop pulling our hair out. I'm Dr. Abby Waldman. Be well.